Hi guys, welcome back to Nigerian Princess, my YouTube channel. If you are new, like and subscribe. So today I want to talk about working as a tech while in nursing school, what to expect. I want to touch on it again, like my last previous video, like 5 things you should know and be aware of. So working as a tech, it came about because when you finish your first adult health clinical in nursing school, you can sit for your CNA. In Virginia, you have to demonstrate your skills, 5 skills that they choose, and then you have to also pass the written exam. If you are from Virginia and you're sitting for this, the exam is not really hard. It's basically an easier version of adult health, like the lecture. So if you did good in adult health, which you probably did because you're looking at this video, you will be perfectly fine on this written exam. And same for the skills. It's like hand washing, perineal care, stuff like that, brushing the patient's teeth, how to turn a patient when they have a weak side. Those are things you should know and skills you should have. So in order to sit for the exam, you have to go to Chamberlain. They'll write you a letter saying you're currently in good standing with the school, you have successfully completed this course and clinical, and they're basically giving them a set amount of hours, and then you just send it to them and then you can sit for the exam. In Virginia, it's $120. That includes the written and skills portion that you have to demonstrate, and it's all done in one day. So after you take the written exam, you immediately do your skills portion. So yeah, I recommend you wear scrubs to this, because I wore heels. I wore heels and an outfit because I had somewhere to be afterwards for a presentation for school, and I didn't, for the skills portion, definitely just wear scrubs. Just wear scrubs there. So anyway, let's get into this video. So 5 things you should know before you start working as a tech at a hospital while in nursing school, okay? Work with your schedule. I'm lucky enough I work for George Washington University Hospital as one of their techs. I was lucky enough to be able to only have to work once a week, and I could choose the day, and then I could pick up shifts when I wanted to. It's part-time. That helped me with maintaining my school schedule. Like, my school was my priority, so whenever we were doing our 8-week work schedule, I would just look at my schedule for school and match it up to that one free day that I have, and then I could just pick up when I wanted to, because I didn't want to sacrifice not taking a class for going to work. So yeah, that's one thing you should be aware of, is your scheduling. Prioritize your school schedule for sure. Number 2, I want you to be aware of the experience. Honestly, that's the main reason why I sat for my CNA and wanted to work as a tech, is because I really wanted experience outside of the clinical setting, where our scope is kind of small. We only did was pass meds. But on top of that, not even, especially during this time, in the pandemic time, where a lot of hospitals aren't allowing students to come for their clinical and it's now virtual, working at the hospital has been so beneficiary for me. I feel like I benefited the most, because the nurses are super nice. They're helping me, they're talking me through what they're doing, and I'm just listening. Obviously I can't do it, I'm not licensed, but watching it alone, I feel like I could go through the steps of a blood transfusion because of how many times I've seen it. If you become a tech, although it's nice to work in an ICU, I think it's super important to start on a med surg floor, where you can see so much. You literally are exposed to so much on a med surg floor. And I also got to practice other schools. So not only do you get to witness and I feel absorb more experience, a third thing along with that experience is you get to actually practice your skills. I got to place external catheters, condom catheters, the pure wicks that we use, those are nice. And then I got to do blood draws. I haven't been able to start an IV yet, because most of the patients that come to the floor already have an IV, but I feel confident enough to start one, because of all the blood draws you get to do, to help the nurses if the nurse wants you to. But 3, I also learned how to work through the hierarchy chain. If you have, that's the 3rd thing. So first I said scheduling, second I said experience. My 3rd one is gonna be working in that type of environment, just a 12-hour workday alone, I think, is a helpful way to transition you, like, after we graduate, into what your schedule is going to be like when you're a nurse. Like, I've previously worked as in a 12-hour shift, like as a patient safety associate at Inova, and that 12 hours I worked the night shift. Oh my god, like, so rough. So I definitely recommend, like, if you don't already work a 12-hour job, I highly recommend, like, studying to become a tech so you can get accustomed to it. And then, like, then it's just like a normal work day for you. It doesn't, because you do get tired. Like, you need a break sometimes, but it's just good to get used to. Outside of that, so we have scheduling, experience, the actual working shift. That's 3. Number 4, I think, working as a tech in nursing school. I'm gonna say that, I don't know how to say this. I feel that you quickly, like, this kind of relates back to the shift, but not really. You have, like, a work ethic. Like, you really do learn to appreciate these nurses. And I remember when I was in clinical, like, sometimes you would see obviously this happens at every hospital, but sometimes, like, at clinical, you would see that some of the nurses just, like, didn't have a relationship with their techs, or, like, their techs would never pick up their phone. I realized how locked a tech's job and a nurse's job are. Like, the nurse is relying on the techs, and the techs are, like, you know, trying to help the nurses out. But there really is, like, I would say they're, like, they both could influence each other's workday, like, greatly. Like, if you have, like, a tech that's never gonna answer their phone, like, never gonna help you, like, always is busy when you call them, you're gonna be struggling, because then you have to, like, go to every patient's room, and, like, they have, like, a span of, like, you know, they have, like, meds to do and stuff like that. But it's vice versa too, because you could have, like, an amazing tech, and then the nurse is just, like, calling you non-stop for, like, nonsense, like, absolute not, like, something they could, like, do, like, oh, I'm in the patient's room right now, but, like, they want to be turned right now, but I have something else I have to do, so I'm leaving the room. Could you just come by? Like, it's kind of like in your head, you're like, couldn't you have done that? Like, and the frustration, I can see it going both ways, because I have seen it both ways. Like, as when you go to clinical, like, you witness it a lot more. So I think when you're, like, working in this type of position, it's good. It's a good skill to have, to be confident enough to, like, talk to your nurse that you are working with, because you're not working with just one nurse, you're working with multiple nurses. So if, like, the 2 nurses are helping you out, and there's one nurse is, like, throwing all these, like 2 patients are complete total care of your 13 patients on you, like, not willing to help, you're always obviously gonna get overwhelmed, because you're trying to help everyone else out too. So it's important that you, like, are able to, like, pull them aside. Like, don't feel, you know, uncomfortable doing that. Like, obviously your manager should be made aware of the situation if it doesn't resolve itself, but you have to be comfortable in these positions being like, hey, like, can you help me out? Like, I understand you're busy as well, but it's hard for me to, like, take care of this one patient's need every 5 minutes when I have, like, 10 other patients calling me and they need help as well, like, going to the bathroom, and this patient's need is not as significant as that. Like, yeah, just, you know, some people, that's not them, like, they just go straight to the charge nurse or the unit manager. I think you should definitely start with the charge nurse, and if you don't see a change, then, like, unit manager. But always remember that hierarchy chain, you know, you don't want to jump over somebody, burns bridges, don't do that. So number 5, be aware of how how much work you are going to be doing. Like, I think I went into this thinking that I wasn't, like, because I was working at a rehab facility prior to working in the hospital. Like, I worked with rehab, and it was, like, the same thing, 13 patients, but it's night and day. Like, the work I did as a tech, like a CNA at a rehab facility, is, like, complete 180 with what I'm doing at the hospital. Like, I'm emptying out drains, ostomies. You're obviously cleaning a patient, which you do at a rehab center as well. Maybe I'll bring this up in another video, like, differences between a CNA in a rehab facility and, like, a patient care technician in, like, a hospital. Like, the differences in the job and the pay. because that's important as well. But anyway, like, the work you do is a lot. Like, sometimes you'll have patients that are very assist, and like 5 of your patients have just like gone to the bed, and then all of a sudden you see yourself spending 20 minutes in each room, and an hour has gone by, and the next thing you know, like, vitals are due and everyone's calling you because your finger sticks aren't done, or the blood job didn't go down to the lab or whatever. So when you go in, I think it's very important to realize you are one person. You're not a superhero. Whenever I answer my phone and I already know I'm in another patient's room, I already have to go somewhere else, if what they're asking for is water, I'm literally like, usually it's a nurse's call, so I'm like, hey, like, can you just get it for them real quick? Like, I'm gonna be in these next 3 rooms for the next 20 minutes each cleaning this patient. Like, if they want it right now, they're gonna have to be waiting like an hour. Like, I don't know, like, if you could just help me out. Like, that's another thing, communication between you and your nurse right there. So yeah, those are my 5 things for you to consider, which is scheduling with school. Make sure that's very clear from the interview, like, you are in school full time. You at nursing school, this is a lot of work and dedication you have to put in. Number 2 is the shift itself. No, what was number 2? It was like, I'm wrong. It was scheduling, experience that you get, how long this shift is. Just be very, very aware. Communication, between your nurse and your tech, and that hierarchy chain is very important to remember. And my last and final point was to be aware of your time management, and also link back to communication. Like, things are very fast paced and you have to keep up with that pace. You can't just go into the supply closet and cry for half the shift and never show up. But like and subscribe, guys. Thanks.